Hello and welcome back to GP Video Podcast by Nadia. So today we will be continuing with the topic of antenatal care, which I started yesterday. So as I told you that antenatal care involves like from the very first presentation of pregnant women who has just done the urine test and has found out that she's pregnant. She presents to the GP, then she gets first set of antenatal bloods that are quite exclusive, and I told you all the blood tests that gets done in the first antenatal lot of bloods. It gets done as soon as the lady comes in. We get all those bloods done. Then the first scan or first ultrasound scan or dating scan or obstetric scan is done at around 7 to 8 weeks for expected date of delivery, and also to see whether there is heartbeat and what is the crown rump length, because that is important for establishing the viability of the fetus. So first set of blood tests, which includes a lot of blood tests. I told you all about them in my first video podcast. And the first scan is around 7 to 8 weeks. That is done for expected date of delivery and the viability of the fetus. So what happens after that? So next steps are, as I told you in the previous podcast as well, that we have to make sure that the lady is taking her pregnancy multivitamins, especially in multivitamins, folic acid, iron, vitamin D, B12. They are very, very, very important. So multivitamins are most important. And if the patient is having, of course, nausea, vomiting, so ondansetron wafers are very much recommended. There are other anti-nausea medications as well that can be taken in pregnancy, like pyridoxine, vitamin B6. But yeah, preferred is ondansetron because it works really, really fast and really, really well. Then after that, the blood tests that can be done is at the 10th week, which is called NIPT, or non-invasive prenatal testing. Is a blood test that happens anytime after 10th week. It is a bit of an expensive test. I just got to know recently that in my practice here, it was told that it was around $500. It's an optional blood test, but it is very important because it screens for genetic abnormalities in a fetus, and it is different from the genetic carrier screening that we do on the mother, which is either before pregnancy or in the antenatal bloods, because that's I told you yesterday that screens mother for cystic fibrosis and some spinal issues, spinal muscular atrophy, and Fragile X syndrome. But this one actually tests the fetus or the child for genetic abnormalities. So it screens the fetus for genetic abnormalities like Down syndrome, which is trisomy 21. So Down syndrome, then there are other trisomies like trisomy 13, trisomy 18, Turner syndrome, Klinefelter syndrome, triple X syndrome, Edwards syndrome, and Patau syndrome. So these are the syndromes that the fetus gets checked for in NIPT blood testing. And if you don't get them done, you can miss these. So especially it's very important for the women who are above 35 years of age, because maternal age really works like a big factor in these syndromes, and also any family history. So it is very, very important, but it is optional because of course people who can't afford it, no one can force them to get them done, but it is like every GP would advise them, and if you can get them done, that would be great. So that is any time at 10th or after 10 weeks. And the most not surprising, but the most exciting thing is that you can get to know gender as early as 10 weeks in pregnancy now, which was a very new thing for me last year when I got to know about it. So if you want to know the gender, you can tick the gender box on the NIPT form, or if you do not want the gender to be revealed, you just say that we do not want to know about the gender. So you can get to know the gender, and you can get to know all these genetic abnormalities in fetus. How does it do it? It analyzes the cell-free DNA in the mother's blood to identify chromosomal differences. So what does it do? It analyzes cell-free DNA, cfDNA, in the mother's blood to identify chromosomal differences. And that's how it detects and because it is non-invasive, which is initially when we didn't have NIPT, there used to be the invasive testing like amniocentesis or chorionic villus sampling and stuff like that, the invasive, in which you had to go to the uterus and get the sample of the fetus to diagnose such conditions. But nowadays it is just non-invasive prenatal testing, which is just a blood test, and then we can get to know about all these genetic abnormalities in a fetus, and also can get to know the gender as early as 10th week. Then after that, there is another ultrasound scan at 12th week, which is also called as knuckle translucency thickness ultrasound scan. And if needed, if there is any problems within that scan, that is also combined with some other blood tests, which is called free beta HCG and pregnancy associated plasma protein A or PAP-A. So knuckle translucency again is another test which is very, very important, and why it is important I'll tell you in a second. So knuckle translucency test also tests for Down syndrome. A knuckle translucency scan measures a fluid-filled space behind your baby's neck. This measurement can help your doctor estimate the chances of your baby being born with a genetic condition such as Down syndrome. Having a knuckle translucency scan is optional. This scan is towards the end of the first trimester of pregnancy, which is the 12th week. Now you can question that when we've done NIPT blood testing, which is also for Down syndrome, why do we need a knuckle translucency scan? Yes, that's a very good question, to which I also don't know the answer, but apparently if NIPT has missed that, knuckle translucency scan would definitely pick it up, and so we will have, you know, all combined risk assessment is definitely done. So I'll again repeat, first lot of blood tests as soon as you come in with a urine positive test for pregnancy, which includes everything, including your blood group, your pregnancy hormone, your serologies, everything, FBC, EUC, LFT, vitamin D, your iron, your B12, everything is measured in that. Thyroid function test, glucose, cholesterol, everything. Then we get a dating scan ultrasound scan at 7th to 8th week. Then we get NIPT blood testing at 10th week. Then at 12th week, we get a knuckle translucency scan. And if that shows that has a bit of ambiguity, then we do another set of blood tests combined with this, which is called combined risk assessment. So this composes the first trimester basically. So in first trimester, the mandatory scan is one only, and mandatory set of blood tests is also one, the number one. But after that, NIPT blood testing and 12th week knuckle translucency scan, and along with that some other blood tests, they are all optional, but they can all be done. I will talk to you more about it in my next podcast.